The body is a self-healing, self-regulating device, and it has the wisdom to heal itself. No one heals anyone. Healing is from within, the divine orchestra that the universal intelligence provides for us all. But it doesn't express itself fully all the time, and sometimes that expression is less than what is necessary to overcome a lot of different stressors. Lifestyle is key. The body needs help to self-regulate within the ever-changing environment we call life. We are back to the aspect of homeostasis. Your body wants to stay in optimal homeostasis, but to do that it needs the conscious effort from the brain, the ego, the you. Being out of homeostasis means the body must try to adapt its systems to the stressors. If it can't adapt to those stressors, then you have disease. These issues all have something in common, which is mitochondria, because it is the source of life force cellular energy that it is able to drive the universal intelligence within. Metabolic medicine is the future of medicine. All healing comes from within, but when the body runs out of life force, essentially running out of battery power, that battery power comes from our mitochondria. The idea of allowing the full expression of energy at a cellular level as being a treatment is the primary goal of metabolic medicine, whereas allopathic medicine, which is the standard of medicine throughout the world, is really very much a pro-pharmaceutical game. They are treating the symptoms, not the root cause. Symptoms are just the alarm mechanism to warn us of internal imbalance. Pharmaceuticals may relieve some symptoms, but, as we all know, they create even most imbalance due to the multiple side effects associated with each drug. But we are getting sidetracked here. Back to mitochondrial health. Metabolic medicine is actually the treatment of the core issues causing the problem. We live in a world full of toxins, and the body doesn't always have the capacity to clear those toxins efficiently due to lifestyle and quality of self-maintenance. When these toxins build up to an unmanageable level, we start having a major upregulation of inflammation. This causes bodily breakdown. This affects us in multiple ways, but one of the biggest effects is the shutdown of our cellular life force. It shuts down our mitochondrial function by up to 90%. They call that the Warburg effect, or the cell danger response. So you can imagine if you're already having some physical challenges and then you are faced with a depleted life force, the outcome is not very good, to say the least. This is the aspect of comorbidities. Now let's look at methylene blue. To explain what this product is, methylene blue is a synthetic salt, and it was developed in the 1800s. It was originally used as a dye, and was eventually used to dye human cells and tissues for research purposes. Once under the microscope, it didn't take long to realize that the methylene blue had quite an affinity for.
This video is brought to you by Wise Onion Nutrition. Discover Zen Fire, the world-class vitality and virility supplement. Ignite your inner youth and metabolism, ease your blood flow, and boost your heart health. Our unique synergistic formula of 20 high-quality ingredients will sharpen your cognitive clarity, supercharge nutrient transport, and bolster your energy levels. Experience the high micronutrient value, improved blood sugar control, and potent antioxidant power. Benefit from reduced inflammation, faster recovery, and total hormone balance. Revel in improved sexual function, anti-aging properties, and enhanced digestive health. Zen Fire, your key to optimal health, no matter your age or goals. Try it and embrace the power of nature. Available now at wiseonionnutrition.com.
The mitochondria just kind of sucked up the methylene blue. So they noticed the cells that had a higher content of mitochondria would become much bluer. Subsequently, they noticed the nervous system cells have much more mitochondria because of the quantity of energy that the brain and nervous system needs. Methylene blue passes through fat barriers very well, and being able to pass through fat barriers efficiently means that it can cross the blood-brain barrier, and it's been tested to see if it can actually help against neurological diseases like dementia. This is a perfect aspect of what I've always mentioned over the years, that fat itself is an inhibitor, and anything that can bypass that barrier is an excellent tool for health. It's been shown to increase fat oxidation in the brain, which is a marker of healthier mitochondria as well. These mitochondria work to convert oxygen and glucose into something called ATP, which is the fuel and currency of the cell. This is when the first researchers really noticed that methylene blue was more exciting than just a dye. It was Paul Ehrlich who was trying to discover a cure for malaria. During his research, he used the dye to look at the parasite that carried malaria and to better see what would work against it. But by chance, he found that the dye was the cure that he was looking for. Subsequently, Methylene blue was used for malaria, and they used it quite a bit in World War I and World War II. This cure was a huge deal. They began to do further research which clearly showed that methylene blue had a very powerful ability to enhance the mitochondria itself. In fact, it enhances the mitochondria by up to 30%. Findings also concluded that it is very protective to the heart and to the brain. That means by taking it preemptively it may minimize negative effects due to injury, such as athletes involved in contact sports. Any type of head trauma, through impact sports or otherwise, should be looking at methylene blue, as well as melatonin, because they're both so incredibly protective to the cells. Also, if you have a stroke or heart attack and you were taking methylene blue or melatonin prior, it would give you a chance at having minimal damaging side effects. It also can have beneficial effects as an antidepressant because methylene blue enhances mood. Researchers have done very large human trials on methylene blue for depression and bipolar depression, and the results were quite impressive. This is a nice aspect of taking methylene blue. You kind of feel happier and your mood is enhanced. It's also an antibacterial agent, as we talked about with its effects on malaria. They found that it fights against the detrimental microbes that bother humans, making it one of the best things for anybody that has a urinary tract infection, especially if they are chronic. Methylene blue has been approved for use in cases of chronic urinary tract infections. It has shown that it does not harm the body at all. In fact, the term magic bullet was coined to describe a substance with extensive benefits for the body. Chronic urinary tract infection sufferers are often prescribed antibiotics despite the known damage these drugs cause to the microbiome. Considering the microbiome's crucial role in health and well-being, it's concerning to jeopardize our well-being unnecessarily. However, with the patent for methylene blue expired, there's little incentive to promote this beneficial product, as profit often takes precedence over health. Thousands of patients, particularly the elderly in nursing homes, could benefit from methylene blue's potential. It's a powerful tool for health. It's important to note that, like anything, excessive use can have negative consequences. The recommended dose ranges from half to 4 milligrams per kilogram of body weight, or a basic dose of 40 to 80 milligrams per day for 3 or 4 weeks, followed by a week off. Starting with a lower dose is advisable to allow the body to adjust and avoid potential discomfort due to the elimination process. Additionally, ample vitamin C intake is beneficial, and methylene blue is well absorbed orally. While it may turn urine blue, staying hydrated will restore its normal color. Embracing the novelty of peeing blue can even be fun in the snow. Hope you enjoyed this video. If so, please like and subscribe to my channel. Stay tuned for more interesting topics.